Assalamualaikum and a very good morning to my beloved audience. I'm Maisara Subahatina Muhammad Fuzi from PHM 245A1 going to talk about my persuasive speech entitled Animal Testing, Stop the Cruelty of Animals. Without further ado, let's get started. Each year, an estimate 192.1 million animals are used in science across the globe, as stated in an article published in 2022 titled Animals Used in Research Overview, provided by the MSPCA Angle Association. At some point in our lives, we have adopted an animal or can think of someone close to us with animals we care about. How would you feel if your pet bunny or even your childhood puppy was forced to consume a lethal substance till death or have their body dissected without any anesthetic or prior euthanasia? Today, I will reveal many problems associated with animal testing and the importance of switching to alternative methods for a more promising future in cosmetic and medicine. I will begin by providing information about the animal testing itself. There are many people around the world who are not aware about animal testing. So today, I will spread the information about animal testing. Numerous animals have died in laboratories. They have been tortured and experienced the unbearable aches and pains throughout their life. Each year, nearly 100 million animals have been dosed with poisonous element, driven insane, and deliberately infected with diseases such as cancer, diabetes, and AIDS. Furthermore, the use of animals in experimentation is unreliable and efficient in terms of time and cost. The Institute for Youth and Policy's webpage, Animal Testing Falling and Commerce, date 2021, demonstrate how animal testing fails in money, efficiency, and most important, accuracy. It turns out 95% of drugs tested to be safe and effective in animals fail in humans. We must end cruel methods, especially since cheaper, faster, and more effective alternatives are already available. Now, I have told you about the need for the cessation of animal testing. I will share the possible courses of action companies can take to replace them. Alternatives have been around the decades. However, those in favor of animal experiments assume that alternate practices will never align with the world live animals have in the lab. In addition, proponents of animal testing assert that the abolition of animals might severely threaten both global safety and the credibility of biomedicine. On the contrary, those on the opposing side combat this claim by highlighting that studies on animals poorly predict human reaction. Therefore, those on the opposing side feel that animals are suffering needlessly. Created by two British biologists, William Russell and Rex Birch, in the 1950s, the terms are now routinely used by experts and animal rights activities. The key to terminating animal testing is to focus on the replacement aspect of the 3Rs. In an interview named Alternative to Experimenting on Animals with Dr. Charu Chandrasekera, made public in June 2022 by the Animal Justice Academy on YouTube, Dr. Charu of the Canadian Centre for Alternative to Animal Method, CCAAM, offers two main categories of animal-free methods. She oversees first-hand, in vitro, and ex vivo. The first type she described is in vitro testing, a Greek term translated as glass and refers to examining tissue in petri dish. She regularly used in vitro testing techniques in her lab, such as 3D bioprinted tissue models and perhaps most intriguingly, organs on a chip that incorporate human cells growing in cutting-edge technology. The chip successfully imitates human psychology, illnesses, and drug responses more closely than crude animal trials do. She identifies the second form in the interview as ex vivo, meaning outside. This procedure examines any organ or tissue removed from the human body. For instance, if someone needed a heart transplant, the defective organ would not be discarded but returned to a research facility that can make it start beating again. This alive heart can be infused with various drugs and chemicals, leading to discoveries concerning medications, chronic disease, and much more. Seeing as I have presented several options that can be used to replace animal testing, it is eye-opening to hear about the way each of us are impacted on these alternatives are not used in the lab. Unfortunately, consumers are left to pay for the consequence of the damage that animal testing has on humans and how it negatively influences the healthcare field. Medical doctor Gail Evan Norman investigates this issue in an article titled Limitation of Animal Studies for Predicting Toxicity in Clinical Trial. It is time to rethink our current approach. Launched by the Journal of the American College of Cardiology in 2019. Norman observed two critical wrong decisions regarding animal tests on human pharmaceuticals are falsely identifying a toxic drug as safe and falsely labeling a potentially useful therapeutic agent as toxic. These drawbacks are not hypothetical either, although I wish they were. Norman reports that a drug deemed secure by animal testing called Vioxx end up being fatal in humans even though they were harmless in animals. On a brighter note, the alternative mechanism previously introduced will propel us into an era called personalized medicine. Dr. Asha Akhtar, the CEO, and President of the Center for Contemporary Science, sheds light on how this new medical technique applies to a specific person's genetic profile. In the YouTube video, The Future Without Animal Testing with Dr. Aisha Akhtar, made accessible by the Sentient Media podcast in 2021. She communicates how models like the organ on a chip will benefit future human health. Doctors will one day be able to determine whether a drug or a vaccine will be effective in the bodies of, say, a middle-aged white man, an elderly African American woman, and Hispanic newborn, and everyone in the world. To make these strides, however, companies like the NIH and other wealthy government agencies need to fund organizations working on these advancements, such as the Center for Contemporary Science. As you can easily see, I have told you about the limitation of animal testing and given various non-animal approaches to counteract these obstacles. We will not able to advance towards the undoubtedly bright future that replacement technique will bring us if we keep harming animals for human gain. As human beings, we are consumers, animal owners, and have the power to change the unacceptable way we treat our planet. Every poke, abuse, and kill animal we take advantage of every second animal test occurs. As we speak, an innocent animal is either burned alive, cut open, or murdered without mercy.